In the meantime, it's an important story that we, of course, are following closely as we track the pandemic and what it means for all of us. We've seen a variant strain show up in Dallas County. This is the same variant strain that we saw in Britain. A young man in his 20s, according to County Judge Clay Jenkins, infected with this strain. The same one, as I said, that we saw in Britain, and that's what they're calling it technically. It's a SARS-CoV-2 B117. But Jenny, what's interesting here too, and we've heard this about other cases of this variant strain, this person has not traveled outside of the U.S.
Right, and by all means, you guys, it's very likely that a lot of people, unfortunately, have this strain here in Dallas County, perhaps in Tarrant County, perhaps in other surrounding counties, because this is a young man who had been, by and large, in town. So it's very likely we're going to start to hear a crop up of other cases like this, because this is just the first confirmed, right? And sometimes we know, I mean, I know most of you probably at this point have had a COVID test and you know how long it can take for those lab results to get back, et cetera. So we want to dive deeper into this and really figure out what this means for us as a community, if it changes how we live our lives in the middle of this pandemic. So for that, we bring in Dr. Mark Casanova to talk really about this new strain. Good morning, Mark.
Good morning, and thank you for having me this morning.
I get so casual on this show, I should say Dr. Casanova, but you know, we're just kind of on this first name basis here. You know, I alluded to that question about, does this change the way that now that we know this is confirmed in Dallas County, this new, as we understand it, more contagious strain, does this change how we should be living our daily lives?
Well, the answer is it should change the way we live our daily lives. If the increased numbers hadn't done it for us and the strain on hospitalizations, the fact that we now have a much more transmissible strain should give us all pause, should cause us to quadruple down on those mitigation measures, and importantly, avoid those congregate settings.
What does it mean, Dr. Mark, by more contagious? Does it mean that those droplets, if you're not wearing your mask, we're told 6 feet social distancing if you can't wear a mask, does it mean that those droplets carry a higher viral load, and so at a distance where it otherwise might have dissipated and you wouldn't catch it, you're not as fortunate with this strain?
Well, it may not be a difference in viral load. It's just that the mutation has caused the what was already a very transmissible infective virus to be that much more transmissible by a factor of about 50%. So if, and we've all heard stories of family gatherings, 10 family members walk away, now COVID positive from that gathering. Now 15 family members may walk away COVID positive. So it's not a matter of an increased viral amount, it's just an increased viral effectiveness. Now, the individual illness that an individual requires or acquires may not be different, but we're talking about a factor of 50% increase in that transmission, which will translate into an increased number of cases.
So let's talk about some of, we know, I mean, listen, every expert has said, don't get together with people who don't live outside your house. We know people are very much still doing that. Obviously, we see that by the numbers and by the photos on social media, et cetera. I have a question about some of these other activities that some families had considered to be safe. So, for example, going to a playground. Remember way back in the beginning of the pandemic where playgrounds and outdoor play areas were closed, then it was instituted that they would be opened back up and signs are up about social distancing. Does this change how we look at, for example, playground equipment? If a mom or a dad's wanting to take their kiddo outside for some fresh air today, is that something that they should avoid now knowing how much more contagious this one is? And does it change the rate of infection via a surface?
We don't have any evidence that fomite spread, which is the surface-based spread, is any different with this virus as opposed to the common COVID-19 virus that we've been dealing with for the last 9 months. But what it does mean is that if you drop those safety measures even outside at the playground within close enough proximity, you're going to be at risk. And then the real issue is, does the interaction stay at the playground, masked, physically distanced, or does it transition into somebody's home for a cup of tea or a cup of coffee? So it's all those subtle decisions. Outside is generally safer than inside, but proximity, mask wearing, hand washing all still play very important parts.
A couple of questions here all wrapped into one. The first one is, do we know if this vaccine will inoculate against this variant? And if so, it's more pressing than ever that we roll them out more quickly and that more people get it. And secondly, does this explain why in places like LA County, where they're sheltered in place, they're seeing a higher rate of infection than even in November when they weren't sheltered in place?
So to answer the question, so far the evidence and what we have available to us is that the current vaccine will protect against this variant strain. The mutation is not significant enough that it will have escaped our protection from the virus. So you're right, all the more reason to get shots and shoulders. In terms of some of the rate of increase we've already seen in areas of our country and even here in North Texas, it does raise a question. Is this B117 at play? Is that what is leading to this marked increase? I think for point of perspective, we've halted the flu virus this year, likely with simple mask wearing and physical distancing. That should give credence to just how vicious this virus can be in terms of its ability to transmit, and this new variant only the more effective in doing so.
Now, when we look at that vaccine, we're talking about even some of the people who are at very high risk. We're looking at perhaps March, perhaps later, when they will get the vaccine. Do we know how long this vaccine will be effective for?
Honest answer, no, we don't. It is suggested that it will be effective in the range of a year, give or take, possibly much longer. Unfortunately, that's going to fall into the bucket of more time will be needed to answer that question fully. But I do want to emphasize folks need to, number one, complete the 2-shot series with the current vaccine we have, which is a 2-shot series, but then understand it could take up to 6 weeks for full immunity to kick in. So the last thing you want to do is get the vaccine and then drop your guard. We are seeing folks get infected even after only one and sometimes in close proximity to their second shot.
Dr. Casanova, that's such a good reminder, because I've been thinking about the loved ones who are potentially going to be getting that vaccine and almost thinking, gosh, we can breathe a sigh of relief, or perhaps they can come visit. So I love that reminder that we just have to keep hanging on and just sort of stay the course. So thank you for that reminder for my family and reminder for our viewers' families as well.
Yeah, we really appreciate it, Dr. Mark. Dr. Casanova is with Baylor Scott and White Health and has been really great in guiding us through all of this with all of our questions as new questions arise.